Alrighty. Welcome, everybody. My name is Dr. Michael Kelley. On behalf of the All One Foundation, on behalf of the Autism Collaborative Centers for Excellence, on behalf of the University of Scranton's Peniska College of Professional Studies, it is my pleasure, my honor to welcome you, hopefully back to our series of town hall meetings focusing on autism and related disabilities. Before we get started on our topic for today, and before I start our interview with our very special guest, I just want to cover a few things. First of all, we're live recording all these sessions, right? And so although we do have the camera function turned off, you never know with these Zoom events, right? So if you don't want your image to be recorded, please make sure that you don't turn on your video in the odd circumstance that it works. If your name, when you logged in, identifies you and you don't wish to be identified, please log out and then log back in with a pseudonym. Also, you'll have the opportunity to write in the chat boxes and the Q&A boxes, and we ask that you don't include any identifying information if you don't want anyone to have that information. So you will be muted during these sessions, and like I mentioned, you can submit some questions or comments in the chat or the Q&A feature, and in fact, I have someone here monitoring those, and so hopefully we can get to some of your questions or comments at some point during the interview today. All these recordings will be available typically on the Monday at 3 o'clock following these town hall events. So if you, friends, family, colleagues wish to watch this interview afterwards, you can do so starting at 3 o'clock next Monday. I also want to be clear about the nature of these town hall meetings. So when we started this initiative here, we designed these town halls to be educational, to be informative, to be a part of this wonderful grassroots effort supported by the All One Foundation here in Northeastern Pennsylvania. We're connecting individuals, parents, caregivers, professionals, anyone else affected by autism and related disorders. Even though I and the other professionals who host and get interviewed in these town halls, we do sometimes engage in therapy, we do clinical work. These town halls are not therapeutic, all right? We're here to provide you with tips, tricks, information, education, above all, hope for the future. Finally, I am prepared to ask questions about this topic for like 45 minutes the whole time of this town hall event, but I sincerely hope we can make this didactic and you can submit some questions for me to ask our guest. So with that, let's get started. I'm going to introduce our star guest today, Christopher Banks, President and CEO of the Autism Society of America. Christopher Banks has a comprehensive background in human services in the healthcare arena. He's had a successful record of increasing fundraising efforts, measurably improving revenue strategies, being a transformational leader committed to diversity and cultural growth. Most recently, he served as Vice President of Development and Community Engagement at Charles E. Smith Life Communities in Rockville, Maryland. There, he provided leadership in the development, implementation, and evaluation of all philanthropic and community engagement efforts. His daily work supported the organization's impact strategy and aimed to accelerate growth while building strong community partners. Chris is a native of Hazlet, New Jersey, stone's throw from where I grew up in Philly. He spent the better part of the last 25 years in the New York metropolitan area. He's got 2 adult children. I'm sure he's very proud. Maybe he'll have a chance to tell us about Patrick and Quinn at some point today. Currently, he lives in Rockville, Maryland, and he joined the Autism Society of America as its president and CEO. They're very lucky. Starting in January of 2020. With that, Chris, welcome to our town hall event. It is such a pleasure to have you here. Thank you so much for joining us.
Thank you very much. It's really a pleasure to be here. And the one thing that you didn't mention that I can't let go is the most special part about this is that I'm getting to come back to my alma mater. I'm a graduate of the University of Scranton, a very proud graduate of the University of Scranton. And also because your organization is housed within the Peniska College, and I worked with Father Peniska or for him. So great feelings, and I'm delighted that you thought enough to ask me to come and be a part of this.
Absolutely. It's a small world, and I love it when I can speak to someone else who's Jesuit educated. We went through the same awesome systems. I, of course, went to St. Joseph's University. We can fight about that later. We don't have to do that now. But anyway, we both have our eye on the prize, so that's a good thing.
Greater glory, the greater glory.
So Chris, I am hoping that you can start off by telling us a little bit about the history and the mission of the Autism Society.
Sure, great, thank you. So the mission of the Autism Society is really quite simple, but dynamic, and that is to improve the lives of all affected by autism. And that expands, obviously, not just individuals with autism, but it includes their families, it includes their communities, it includes their employers, it includes their colleagues. It has a very expansive net, if you will, or reach. And of course, we have services for individuals and for families and for self-advocates, and we work together with them. But that is the mission. The history of it is very interesting. Back in 1965, Dr. Werner Langer and Dr. Ruth Sullivan and several other parents of individuals with autism gathered in Teaneck, New Jersey, and sat around a kitchen table and said, we need help for our children in school. And how are we going to do this? We're not getting the special education services that we need. And we need more help with social interaction and with communication skills for our children. And they started putting it together. And Dr. Sullivan has her doctorate in nursing from Columbia University, but yet she still knew she needed special help and special work there. And even when she and her husband were looking to relocate, because he was in the world of academia as well, they settled on a place that had a focus on special education and primary education in public school systems. And that was in Marshall, West Virginia, of all places, right? And there's a great history there as well. But the Autism Society grew since 1965. Where gathering of parents made possible the conversation about what are the needs of our community, what are the needs for the children that have autism and are living with autism. And it really was a children's-based program at that time. Now, those children are grown and are mature adults. Joseph, I believe, is 65, Joseph Sullivan at this point. And, the gap of ages is that and beyond, right? And so the Autism Society has grown through that. And we have morphed and we have always evolved. It's an organic organization meeting the needs as they evolve, as they present themselves. Today, the Autism Society has 77 affiliates across the United States, from Hawaii to Maine, from Washington State to Washington, D.C., and lots of places in between. We're not in every state, but we're in a lot of them. There's opportunity for growth and expansion there. The work of the Autism Society occurs through this very unique grassroots organization. Right? There is no other autism organization in the United States that has that grassroots affiliate and reach that we do. And the work we do is focused on programs and services and resources for families now and currently, as well as for individuals in their adult lives. So that's
I love the
history.
I love that you said the word grassroots, because as soon as you started to talk about, like this, the stories like gives you chills, right? That someone decides in their garage or at the dinner table that they're going to do something, and then it ends up being this gigantic organization that has such big impact. And the fact of the matter is, you're not going to get a more passionate group of people than parents who are going to be intimately interested in their children's outcome, right? And I imagine that your affiliate network really does involve individuals affected by autism specifically, but their families, right?
Absolutely. And not only that, so let's talk about that for a minute, if you don't mind, that the Autism Society has two panels that I'm very proud of. They're collaborators in the work we do. In addition to our lay leaders on the board of directors, we have a panel of professional advisors, people like yourselves and your colleagues in, at the Collaborative Center for Excellence that are focused on autism and services. They may not have autism in their family. They may not have it as part of their own personal story, but there was a passion. Something happened that drew them in. Dr. Mark Ellison at Marshall University talks about, being Joseph's coach, Joseph Sullivan's coach. And as a result of that, he evolves into wanting to pursue a doctorate in the studies of autism and services for it.
That's amazing.
So that panel of professional advisors gives us great academic guidance, programs, services, materials, credentialing of ideas and thoughts. The other part of our system that I'm equally as proud of is the panel of people on the spectrum of autism. Individual self-advocates who have grown through this world of autism in all types of ways. We have members who were diagnosed at 28, You know, I've talked with somebody who was diagnosed at 35. We have individuals who were taught or diagnosed at early age, went through ABA therapies, were taught in all kinds of modifications of training, have gone to institutions like yours, the University of Scranton and others. And that panel of people on the spectrum of autism is invaluable. And again, it's something that doesn't exist in other autism organizations. That, coupled with families who tell us the stories of how they're being impacted on a day-to-day basis and where we need to step up. And we'll talk, I'm sure, more about that. But that spectrum of people is so important for what we do. It's not some office in Rockville, Maryland, next to the ivory tower saying, this is what you should do. It's listening to what the community says we need and then figuring out how do we help them meet that.
Well, you're really putting your money where your mouth is when you do that, right? When you integrate into your organization as a pillar, people who are actually affected by autism.
Right. Exactly.
That's really important. Well, you know, it's funny. It's built into, like, for example, I'm a behavior analyst, and it's built into our ethical codes to listen to your client. But at some point in time, it became obvious to someone that we got to think through making sure you're involving people with autism in making decisions and all that. And it sounds crazy, right? To think that someone had to make that a rule.
Right.
But
right.
I think it's important to make sure you're always remembering that it's a critical feature is to involve people who are actually affected to help guide what you're going to do. And I love that you have that as a pillar.
Yeah, well, I'm very happy with it. And it's also, you know, it's a to, with, for, and by. There are times where it has to be a to because we have something they need, right? The services, right? It's for them, right? That's our mission. That's what it's about, right? It's with them and it's by them. Sometimes we have to stand by and let them do their thing. And then just, you know, that's the real delight, right? To be able to see that growth and that expression of individuality and recognizing this is their talents. This is how we can include them, you know, because inclusiveness is so important to what we're doing here.
Oh, absolutely. So you mentioned your affiliate network, and that's one of the things I found most interesting when I was looking at your website. So can you tell us more about the affiliate network, and if someone wants to interface with the network, what can they hope to achieve by that interface? What does it do?
Sure. So let me perhaps introduce it in a way of how does somebody in the public get introduced to our affiliate network, right? So let's do it from that end. Let's look at it from the user perspective rather than from me as the administrator perspective, sure. Right? So mom and dad have a child that's newly diagnosed, right? Their pediatrician, she's on top of it. She's paying attention to it and says, hey, something seems to be different than we thought maybe, and let's look at this. Communication may have been higher and now it seems to regress, or it just doesn't seem to be on the same levels or at the same rates, and that draws their attention, right? And every parent has that sense, I think, of something. Then the parent says, well, doctor, where do I go? Well, call the Autism Society of America, 1-800-3-AUTISM, right? Our helpline, our national helpline, right? And they call our helpline, and we have individuals on the spectrum as well as individual who has raised somebody on the spectrum to be able to be a support and service. Now, you might not always get somebody who has autism on there. We could connect you with them, but somebody has reference and experience.
That's a brilliant strategy.
Right?
Yes.
Well, you know, if I want to learn how to rebuild an engine, I better ask a mechanic how to rebuild the engine, totally. Right? Agreed. You could tell me how to read the book, Dr. Kelley, but I want the guy who knows how to build the engine, right? So,
no doubt.
And I think that's what Dr. Sullivan was doing when they started, is how do we help families raise their children, right? And we grew and our services grew as those children grew, right? What's it like to have a child in college with autism? In 1965, they weren't talking about that. Now that's a gift. Hey, if you have the intellectual capacity, they should be thinking about college, right? And they have that opportunity. So that diagnosis comes, and then they get introduced to us, the National Autism Society of America, and they call our helpline or they go to our website, and they can click on their geographical area and say, hey, I live in Philadelphia suburbs of Yardley. Sound familiar? And
yeah, I have some buddies that live there.
Right? So they live in that community and they're saying, okay, let us put you in touch with the Autism Society of the Greater Philadelphia area. And the work that Patty Erickson and her team are doing there are just great, right? And here's the programs and services they have. Or they call in and say, we're looking for a behavioral therapist, right? And we live in Freehold, New Jersey, and we're not sure who to go. And then we can say, well, there's this Ann Holmes. She has a great practice. She has this. There are several others, but here's somebody you could talk to, right? And we replicate that across the country, right? Wherever it is. I've just picked places that I'm comfortable with, that I know the geography.
Right.
And once they get introduced to that affiliate, then the affiliate then has that relationship with them. Now, some of our affiliates are, the structure is very different. Each of our affiliates is its own individual 501c3, not-for-profit organization.
Oh, really?
Yeah. They all, and we have, and again, back to grassroots, right? What they raise there stays there. So that is a very distinct difference between our national organization and other national autism organizations. The money does not come to national, it stays locally, right? And the fundraising is used to support the programs and services at a local level, right? So that walk that takes place in Greater Akron, Ohio, that money raised in Greater Akron, Ohio is for Greater Akron, Ohio.
So that's fantastic. I mean, without naming names, you do hear times where the money doesn't stay and it flows somewhere else. And so you wonder about the impact locally, but
right. And I only say that because it's true to who we are, right? To thy own self be true is something you and I both knew when we learned from our education.
Absolutely.
And as a result of that, it follows. That's our grassroots organization, right? Now, national, we do some fundraising and whatnot to support the operations we have here in Maryland. But the real point of my telling that is we put families in touch with their local providers, and we're asking them to support their local providers because the local providers are going to be there for the next family that comes, right? And they're going to be with you through the progression of your child's lifespan, right? I think about, Nassau and Suffolk County right now, right? Big challenge in the state of New York about group homes and about congregate living. And we'll talk more about that, I hope. But, that's what the local affiliate helps families with. How do we advocate for you at the local level? On the federal level, we do the same. We advocate on a federal level, and we're doing more and more on state legislator capitals, and we need to. We have an excellent relationship with your senator, Senator Casey, and he does terrific work for us in the community of developmental disabilities. But we're also talking to Governor Wolf and what's happening in Pennsylvania, as we are in Florida, in Texas, and Louisiana, and Alabama. And, that all happens at the affiliate level. And so we put families in touch with the affiliates who have the programs and services at grassroots level. We put the affiliates in touch with families who could help them and be a part of it, and then we advocate with them. That's what our affiliate structure looks like. We have gaps in where we're present in the United States, just because we don't have an affiliate there yet, but we'd like to see it. But we have the largest network of affiliates in the United States for autism out of any autism organization. I'm very proud of it. Great legacy. I came into a great organization with a great history, and the mission is one that I can really rally behind.
Yeah, it's exciting. So I do want to follow up with you because you mentioned it specifically about group homes, but by way of introduction to that topic, you said autism is a lifespan, obviously, right?
Yeah.
My specialty is in early intervention. It just happens to be where I specialize, right?
Right.
What I hear parents say over and over again is, well, when my kid is no longer age 2 to 6, what now? And at least they have the school system, whether it's adequate or not, there's a school system to be in, but then what, right?
Right.
And people who live another 50 years, that must be on the Autism Society's mind, right?
Oh, it absolutely is on my mind. It absolutely is, right? And we actually hadn't talked about this in our prep conversations, but
I'm
one
sorry,
of the areas. No, it's right on my mind. It's a very timely topic because we're about to begin our strategic planning process here. I'm 6 months in, and it's time for us to look at that. And one of my areas of concern is transition, right? And one of the areas of concern of the board of directors was transition. And when I was interviewing for the job, I asked them to describe their number one concern. And the vast majority, overwhelming majority, was transition services. So what does that mean, and what does that include? Obviously, it includes post-secondary education, right? When most supports end at 21 years old, right? If that's their state, and again, it depends on the locality. So post-secondary education, whether that includes vocational rehab, vocational educational programs, job coaching programs, but it also education services, institutions, again, like my alma mater, your employer, doing great work for providing services for individuals who are on the spectrum, right, and special needs, happening at St. Joe's, happening at Drexel, happening at Rutgers, happening across the United States, Kansas, Indiana. I could go on and on. So there are some individuals on the spectrum that is the pathway that is available for them. There's also those that are that have more severe impacts, and what I like to say have higher communication needs or higher support needs, right? Where college is not their pathway, right? And we need to be thinking about that. What does that pathway look like? And then we have to address in the lifespan employment, right? And I'm asking that we start to think about, and what does assisted living look like? And what does skilled nursing facility services look like? Because the 65-year-old that I mentioned at the very beginning of this is not long away from having to encounter those challenges.
Yeah.
By the way, anybody in the country is encountering, right? What do we do if we get to that age where we no longer can care for ourselves? And, is there something we could turn to?
Absolutely.
I think we have to look at that. And the issue for me, Mike, is very important that we make sure we do it in the context of inclusion, right? Multi-use facilities that have perhaps commercial space on the bottom floor, has younger people living in some apartment or townhouse setting, has SRO or single resident occupancies for some, and has housing for individuals on the spectrum, because that's a human right. Right? It's a human right that you have access to all of those things by virtue of your birth, and we think that is a human right, right? And I say that because, in COVID, some places have had to be fearful of what will happen if I go to the hospital.
Right.
That's a human right. We shouldn't have to have that fear just because we have autism. That's just not part of the process. And we speak about that in our human rights statement. So it's a very timely topic for us. It's a very important topic for me. I want to make sure we're looking at education, we're looking at employment, we're looking at housing when we're looking at lifespan. And we also do a lot of work with financial planning. A lot of our affiliates do financial planning for the parents to make sure that they know how to protect their resources and have special needs endowment funds set up for their children.
I got to tell you, my experiences when the parents sort of get past the whirlwind of diagnosis, what is autism, school, what does it mean, early intervention, and then they catch their breaths after a few years and they say, wait, whoa, what about financial planning? And it is a gigantic stressor.
Yes, it is.
Parents. It's one of their biggest concerns.
Yeah, and we're fortunate that we have a great resource of individuals who are trusted advisors who know this world and are very comfortable in it. Some, in fact, who have children on the spectrum themselves, so they have firsthand experience with it. Some who have secondary because they've been providing great programs and services to families for years. But it's amazing how they jump right from that acceptance of it to the early adoption of these are things to, oh, what am I going to do 50 years from now? Right? But you have to think that way, and you have to start investing that way. And, this is not about funding, but it's about caring. It's not about making sure I have enough money. It's about making sure that the care my child needs, the supports my child needs when they become adult, if they are not independent, is available to them.
No, I totally agree. It's funny. Something you said, it reminded me of a post I saw on Facebook. And someone wrote something like, when we were kids, we didn't have this ADHD and this autism. And someone wrote, I think what you meant to say is you didn't have the proper supports in place to give people their basically access to human rights. And I love that you guys are forward thinking, and it sounds like you're covering every angle of the lifespan to make sure those supports are in place as a basic human right, because you're alive and your life has value like anybody else's. It makes a lot of sense.
Exactly.
That's awesome.
I hope we've covered all of it. And if we haven't, I hope your viewers will let me know about something we've missed. But because it's important for us. And that it too is part of how we treat our organization. We want to hear from the community about the programs and services they're not seeing that we need to make available to them.
Absolutely.
And most of the time, that question, it really turns around to, oh, it exists. Here's where you might want to go to get it.
Yeah. Well, I want to say one thing that stuck out at me on your website was your COVID link. And I got to ask you about it because it's outstanding. Can you tell me all about that?
Oh, sure. That is perhaps the thing in the short time I've been here, the thing I'm most proud of, right? I am blessed to have a terrific team led by Kristen Roth, who handles our marketing. She's our chief marketing officer. And Margaret Miller, we got together right away. You know, I remember the first week of March in my office where I'm speaking to you from, saying, okay, what are we going to do? And how are we going to focus on improving the lives of individuals with autism, our mission, during COVID-19? And we started making a short list of the things we needed. We needed this. We needed to figure out how to have these videos and dialogue to talk to people. So we started with that. And then we started gathering resources. And the generosity of the autism community was terrific. Many institutions made as much resources as possible available. One of the things we defined that I think was very important is we realized we are not going to be the source of information about COVID. That's what the CDC is for.
So you left that to the medical experts.
We left that to the medical experts. Okay. Stay in your lane, right? You know, I'm not going to give you financial advice. I'm going to give you the access to the financial advisor, right? You don't want me doing early diagnosis. You want me to help you with fundraising, but not early diagnosis. We'll let Dr. Kelley do that, right? So we quickly said, what does it have to do with autism, and how are we going to bring it to the families? We instituted a Facebook Live series, which has been unbelievable, similar to what we're doing here today. And, you know, we've had over 100,000 viewers watching that, right? And across the world, I've gotten communications from Europe, Asia, South Africa, Africa, from Australia, around the world, saying, can you do this? Or what about this? How can you help us with this? We're fortunate to have a wonderful relationship with the state of Qatar. And so our presence in the Middle East is known because of the work we're doing here in the United States, but with the state of Qatar. You know, then we started to develop a toolkit, and that toolkit really took off. And the toolkit was a compilation of material, right? And it had information that people could use and that was very important for people. It had stories, and we had social stories that people were donating to us about how do we do this. We addressed topics like education. You know, I love to say this, but all of a sudden bank tellers were asked to be school teachers.
Yeah.
Right? And if you don't have that background, you're going to be really faced with some challenges, right? And if you're the parent of a child with autism, you've already placed yourself at a position of, I need to step in and do something here to help, right? But how do I help, right? How do I help do this? And what do I do with it? And that's very important. And, you know, so the toolkit, we started to break it up into different things like mental health. We knew that was important. Parents were under tremendous anxiety. Individuals with autism were under great stress. So we did that. Education. We helped with modifying routines, right? Our self-advocates were wonderful at talking about, you know, I'm used to, I can get to work on time so long as the bus shows up.
Right.
Now what do I do?
Right.
Right? Self-advocates were talking about, you know, I knew how to get to the grocery store. I knew what I needed to do when I got to the grocery store, and I knew which aisles to go up and down to get what I needed to get. I can't get to the grocery store. And if I get there, I can't get in. And if I can't get in, and if I get in, the things I need aren't on the shelves. Right? So our self-advocates really helped with talking about that. Of course, our toolkit includes public policy information. We've been active in all of the stimulus bills and making sure that autism and the developmental disability community is represented. It's lockstep and barrel, and we continue that. We have put lifestyle supports together, and we've put as much as we can in Spanish. I'd love to have many more languages, but in time. But we've tried to put as much as we can in Spanish. And, you know, right now, for example, we're doing a lot about face mask wearing, right? Because that's a challenge for some individuals on the spectrum. it's a challenge for some people who aren't on the spectrum either, right?
Yeah.
But now we're starting to build branded material around returning to school or work. As uncertain as that is, and we're not in that debate, that's not my debate to have, that's for the health officials and the states. We have an opinion and we'll offer it when we're given the opportunity to. However, we need to be available to provide resources for what does that look like going back to school. I'll give you a classic example that I'm concerned about. I'm concerned about schools and their policies for disruptive behavior for individuals with autism who may not be quote unquote compliant, right? The mask comes off, what happens? And then that child gets confronted or challenged, what happens? Or social distancing, right? How do you measure that now? For some individuals on the spectrum, that's not going to be a challenge because they don't want to do that. But for some, it will be. And for others with developmental disabilities, it will be absolutely an issue. Those are the things we're building stories on. You know, in the middle of it, we built stories on how to get tested and what that test is like. You know, whether it's a nasal test, whether it's a tubular test, or whether it's a, you know, whether it's a blood test. How do we prepare people for that? So the toolkit has all of that in it, and it has a lot of advocacy work. You know, we've engaged thousands of people, over 12,000 people have been involved in writing, communicating with their elected officials and legislators on behalf of the autism community as a whole. That's what our toolkit has. I'm proud people have jumped on it and taken it. NBA Cares, their charity, asked if they could have permission to use it, and we said, yes, go, take it. NASCAR.
Permission granted, right?
You know, NASCAR, whatever it is, you know. Again, people were so generous in sharing it with us. We put it together. We're generous in sharing it. We've been doing one or two Facebook Lives a week since March 13th, and we'll continue to do them and continue to educate people. That's all in a toolkit, and it's a pretty exciting thing.
That's amazing.
It's free, and it's on the website.
So one thing that really, a couple of things that stuck out to me when you talked about the kids going back to school and preparing the system for that, you might have individuals with autism that might run into some trouble, right? And especially like with the mask and all that. But it got me thinking more broadly too. I believe you and I talked before about your efforts to educate like law enforcement and judges about autism, right? But it's the same thing, right? Because you'll have individuals with autism who may not be responsive or might not behave the same way that a teacher, a judge, a police officer might expect, and therefore trouble could ensue. So could you tell us a little bit about how the Autism Society helps prepare systems for interfacing with, again, people who have the same right as anybody else to walk around this green earth and live their lives?
Yeah, so it is a very timely topic, right? As we continue to have this tumultuous situation going on in our country where Black Lives Matter have a right to be recognized and supported, and we need to figure out that conversation. And I bring it to all Black Lives Matter, and that includes Black individuals with autism, right? And we have affiliates who do an excellent job of training police officers and first responders, and I'd like to see more of us doing more with magistrates and court systems as well. Because unfortunately, there are too many stories of individuals currently incarcerated because there was a failure in communication. You know, I visited the L Center in Florida, and I learned a great lesson there. And the leader there, he said, you know, I like to refer to this as when people talk about disruptive behavior, what it really is it's a challenge to communicate, right? It's a communications challenge. Well, it's the same whether it's in a school, whether it's on the playing field, whether it's on the streets of an American city or community, right? That when two people aren't able to come to a parallel messaging, there's a challenge to communicate. And it's incumbent upon the Autism Society to make itself available to serve and to train. So many of our affiliates have training programs, right? Safe and Secure is a branded program that we offer, and it's to educate law enforcement across the country about how to do this. I'm preparing, and you're going to get the insight, preparing a letter to the International Association of Police Chiefs to tell them, this is available. Take advantage of it. We have 39 affiliates across the country who are willing to educate your officers, your first responders, to how best to interact with an individual with autism. And I can assure you that they could use that in other circumstances.
Absolutely.
You know, I had the fortune of working in the healthcare systems and being part of what was called the de-escalation team, right? Where somebody's in an uncomfortable situation in the emergency room for whatever reason, and you have to go in there and try and de-escalate it so the great caregivers that are there can do the work they need to do, and the patient needs to be compliant about it. Same thing here. So we're doing some work with that. We have that available in many of our affiliates doing that, and that's also part of our strategic plan where I expect to expand that to many more people.
That's fantastic. I would love to know what the reaction is to your letter, because it's so necessary, and I really hope people take advantage of that. Right? I mean, we're at the point.
And I would say to you, Michael, the thing that is really unique about our training, though, and I should have said this earlier on, is the training takes place based on good knowledge and good curriculum background. And it's usually presented by a facilitator for that.
Mm-hmm.
It includes an individual with autism. It includes a parent, right? So you have somebody who can represent themselves and speak for themselves, a self-advocate, but also as a parent whose child might not be able to because they have lower support skills, lower communication skills, and higher support needs, right? And so we have to help with that too.
Yeah, so important. And I love the way you framed all this in terms of communication, right? If you could see a confusing or ambiguous situation as a failure to properly communicate as opposed to a threat, everything, the whole framing can change, right? And everything becomes a much safer, more humane encounter.
Yeah, right. And you know, it comes back to an old principle that you and I both learned at our education, and it's seek to understand rather than be understood.
Yeah.
What's going on in your world, Mike? What's happening? Why are you acting this way? What a great way, I think, of bringing this together, right? And interacting. And as you can hear, I mean, this was a great opportunity to come on board with the Autism Society because I got to use some of those values and mores and cultures that I learned at the university and bring them to here.
Oh yeah, I mean, I hear your passion in the way you talk about it, and I'm so excited for you. I just love these initiatives. The COVID one, what I think is amazing about that is how quickly you were able to mobilize and get that out on a national scale. That's the most impressive part.
And you know, we had some great help, right? Make Waves, a wonderful foundation, donated the resources to make it possible for us to provide 53,000 masks to group homes.
Oh my goodness.
Right? And that was because of what we've done at COVID-19 Toolkit, that folks at Make Waves, hey, how can we be a part of it? Conversation, we're having trouble getting masks to this. And we've talked to our legislators and elected officials about it as well, but we were having trouble, and they provided a venue. They had a resource to get those masks to us, and we were then able to get them to the affiliates where the crisis was at its high point.
Well, and that's been the biggest. Well, it's funny, right? So with PPE, you heard all the problems in hospitals, and the issues in New York City were so dominant for a long time. But then once that sort of waned a bit, you heard about, well, what about group homes? What about, and the list goes on and on. You know, there's a gigantic network nationally of these homes where they're serving individuals with autism that really do need those resources. And I imagine
without a doubt,
53,000 is a huge number, but I bet you they went through them
very quickly. Right. And you know, that the whole issue of group homes is so important for people to understand, right? That you have to think about it. And so I'll ask people to just pause for a second. So you have a house, and let's create numbers. You have 12 individuals living in that house, and you have 18 to 24 staff members who work around the clock, because they have to have somebody there around the clock 7 days a week, 365, right? You're in this group home, and it's a great place for you, and it's a comfortable place, and the team are doing great work, right? But all of a sudden, you can't see your mom or dad or your family or your brother for 4 months.
Right.
Right? They can't come and get you to take you out for that traditional Sunday gathering, whatever that is, or that ritual that you're used to. And we know that individuals with autism like routine,
Exactly.
right? They like schedules. They don't like to see it modified. So every Saturday is the day I do this with my mom and dad. Now I can't, right? You know, what about, where's that love? Where's that understanding of, this is not about an absence of love from mom and dad. This is the limitation placed on it by the circumstances. Then it gets exacerbated because we have such great DPS, these service providers, right? Disability service providers in the group homes who can't go home because they don't want to infect their family if there's somebody in the group home who's been infected. They don't want to take that risk, right? We've heard stories of nurses who graduated from the University of Scranton who are sleeping in their garage rather than coming home, rather than going into the house, right? Great page that the university put together about committing messaging and dedication about our medical professionals, nurses and physicians and others. Well, you have that as well as in the group homes, right? We spent a lot of time at the Autism Society of America talking with elected officials in the state of New York, all the way up to the governor's office. I had conversations with the head of the Senate majority. I had conversations with congresspersons for Nassau and Suffolk County, trying to get those PPEs, that personal protective equipment for the workers, right? To protect the workers so that they could continue to serve the residents. We're starting to see a little bit of it, but I'll tell you the challenge is the governors right now are not including group homes and congregate living settings in their phase planning. Unfortunately, we saw governors thinking about how do we open bars before they thought about how do we get families reunited. That's a real tragedy. That's a human rights issue.
Right. No, I understand. I mean, it's going to be, it's noisy, right? People want their cheeseburgers in public and they want to be able to go back to a normal life. But of course, the world in which you and I are operating, right? We're plugged into something a little different. That's more fundamental.
Yeah.
You know, that's very, very interesting. Well, you mentioned about legislators, right?
Yeah.
And I looked at your Action page, Action Now page.
Yeah. Yeah.
And I love it. I mean, there's nothing as powerful as a bunch of, and I don't mean to sell the dads out, I'm a dad, but a bunch of moms together in a grassroots effort, just making noise to a legislator to make their point known. Yeah. And so it looks like you really encourage people to interact with their representatives. And I'd love
to we're sending newsletters out on a regular basis. Our Ignite newsletter goes out encouraging people to send a letter. And we want them to not just click the button to send the letter. We make that possible. Yes, we do. We want them to tell their story.
Yeah.
Humanize this issue. Instead of talking about just group homes, talk about Tommy and Mary who live in the group home, right? And their child and what they are to the community and who they are and what they're doing. Personalize it, right? Our advocates, and I think that anybody who's a member of the Autism Society is an advocate because they've been impacted by an individual with autism. We're telling our elected officials, many of them don't understand autism. We're fortunate that Representative Chris Smith from New Jersey and Representative Mike Doyle from outside of Pittsburgh head up the Autism Caucus for the House of Representatives, and they understand it, and they fortunately take our visits. I get to walk the halls of Congress and talk with them, and prior to COVID-19, and we'll continue to do that. We'll continue to do it. It's very important for moms and dads to advocate on behalf of their children and the community at large.
Yeah, no doubt. So Chris, we have like a minute left in our agreed upon time. And I'm wondering if there's a topic that I didn't get to that you would just love to cover on behalf of the Autism Society before we get out of here.
I really, we've really talked about it. This idea, we made a promise when COVID-19 started, right? And the promise was that we would remain committed to improving the lives of all affected by autism across the spectrum and throughout the lifespan. And that we would focus all of our information and resources and advocacy efforts to address this urgent need. That doesn't mean that the Autism Society is not looking at other things, but we knew what we needed to focus on. We're grateful for the generous support we get from people who make that possible. And we need that, and I would be greatly amiss if I didn't say that. but we are more important for us is to make sure that people come to us if they think they have an issue or a question or concern that isn't being addressed. What we don't know, we can't work with, and we can't fix, and we can't solve, right? But it's a great time to be serving individuals with autism and working with them and working for them and watching them do the work themselves, the 4-2-4 with and by, right? I'm delighted that the Autism Society is going to look at lifespan issues going forward and look at very timely things like employment. And it's an exciting time to be a part of the autism community, and I feel blessed to be here. And I'm so grateful to you and the University of Scranton for inviting me to come back this way to talk.
No, I mean, it's our absolute pleasure. If you don't mind hanging on for a moment, we could debrief at the end, but I just want to say thanks again to the All One Foundation for all your support. Thank you to the members of the Autism Collaborative Centers of Excellence. And on behalf of the University of Scranton, thank you for coming to this town hall event. I hope to see you at one of our next ones. So thank you very much.